Hi, I'm Dr. Heather Hirsch. Welcome back to my YouTube channel. Today, I want to teach you about two lesser known medications used to treat genitourinary syndrome of menopause. The brand names for these medications are Imvexxy, which is vaginal estradiol, and Intrarosa, or Prasterone, which is vaginal DHEA. Both of these medications are something I want you to know about so that you can discuss with your doctor and have more options in that file cabinet or that arsenal of things that could help you through the menopause transition and prioritize and individualize this for you. If you don't know me, I'm Dr. Heather Hirsch. I founded a menopause clinic at Ohio State, and then after that at the Brigham and Women's Hospital, worked as faculty at Harvard Medical School, and I have since written a book and made my way back home, and I now have a private telemedicine practice. I'd love to see you if you're in one of the states that I am licensed, and if not, I also have an incredible course and do lives and a whole bunch to support you there, so you can check those out in the description links below. All right, so what makes Imvexxy so special? So first, let me tell you a little bit about Imvexxy. This medication I've been using for at least the last 8 years, maybe more. I think it got FDA approval probably around somewhere between 2010 and 2015. I don't know off the top of my head, but it's definitely been around for at least a decade or so. Imvexxy was first manufactured by a company called Therapeutics MD. Therapeutics MD was run by a gynecologist who found that women didn't like the current options out there, like Vagifem or estradiol or Premarin cream. Now, actually, a lot of women really do like Vagifem or the creams, but a lot of women do find the creams quite messy, and for some, that's a rate limiting, factor. That's a barrier right there. And some women don't find that Vagifem is as effective as the creams, so they're kind of caught in this, which is the lesser of two evils. Well, Imvexxy is great because it is a quickly dissolving estradiol, so it is considered bioidentical vaginal estrogen, and it is packaged in coconut oil, so women don't have any allergies to it. It's really very soothing. Now, it's a little different than the cream because it's not as messy, and I'm going to show you what it looks like. Now, Imvexxy has both a starter pack and a maintenance pack. The starter pack is so that you can do vaginal estrogen nightly for 2 weeks, which a lot of people do prescribe it that way, myself included. The maintenance pack looks a lot like this. It's a twice a week basically pill pack, and it's really easy to read. And this right here is exactly what it looks like. I always call this the size of a jelly bean or a jelly belly. And if you know, you know. If you're using this, you could take your fingers, hold it here, insert it into the vagina. It will dissolve, and it's so much less messy than the cream. It is something that you could place in the vagina in the mornings. Lots of women find they can put it in and then go running or exercising and not having any drippage or discharge. In clinical practice, I find it's just a little bit more efficacious than Vagifem, which is a suppository that comes with its own applicator for each suppository, but to each his own. And I want to give you more options again in your tool cabinet that you can go to talk to your doctor about. All right, the other medication that I promised to talk about in this video is called Prasterone. Its brand name is Intrarosa, and it is vaginal DHEA. Now, this was FDA approved, I want to say around 2019, maybe 2017, 2019. During my fellowship training at the Cleveland Clinic in 2014 and 15, we had to get this medication compounded. Now, you can get oral DHEA over the counter, probably at your local Whole Foods or supplement store. DHEA is a precursor to androgens, namely testosterones, and then testosterones can convert into estrogens. So DHEA is not necessarily estrogen or testosterone, it's a precursor hormone, and intracellularly, deep in the cells, it can convert into testosterones and a little bit of estrogens. One of the reasons we compounded DHEA intravaginally for GSM, particularly before it got FDA approval, is because this was a really great option for women who felt they didn't want to take estrogens, who were scared of the black box warning, and even for women who had breast cancer and breast cancer survivors who had such difficult to treat vaginal atrophy. This was a really good tool in the toolbox to have. Because it converts into those androgens, some women do find that it can also boost libido just a little bit, potentially by increasing some local testosterone into that lower genitourinary tract, like the clitoris, the labia, increasing sensation there. And so while it's not approved for that, a lot of women do find it can naturally, I guess, boost their libido. In my opinion, there are really no contraindications to Prasterone. Although again, if you are someone who has breast cancer or a breast cancer survivor, yes, you definitely want to discuss this with your oncologist, and it is always a picture perfect world when everyone agrees. The other thing to know about Prasterone is this is a nightly suppository. So that could be a good or a bad thing depending how you look at it. Now, some women find that they're more consistent when they do something every single night. And because you get 30 in a month, I do certainly have some women who don't take it every night. They may be spaced out to every other night or every 3 nights. So you can kind of make it last a little bit longer, or have at it, use it every single night if that keeps you more consistent. For women who might find that frequency like very cumbersome or just way too much to do, something that's more twice a week like the Imvexxy or Vagifem or estradiol cream that you're using twice a week, or certainly other really good options. The last thing to know specifically about Prasterone, and sometimes Imvexxy, is they're a little bit hard to get. Now, I think if you go online, you can find savings coupons that I absolutely recommend downloading, printing out, or having a digital copy on your phone, because anything can really, really help, especially if you're trying this for the very first time. You want to try it for 8 to 12 weeks to see if this is something that you're going to stick with. Then you want to get as much savings out of it as you can, so that when you continue to refill it, that the benefits are definitely worth whatever that cost might be to you. All right, guys, I hope you found this video really, really helpful. For some reason, it's super dry in my office, so if you hear me clearing my throat throughout this entire video, I had to get this out for you guys, because I know you love all the information. Remember, this is not direct medical advice, but I would love to see you. If you'd like to be a patient in my telemedicine practice, definitely click the links below. Thank you guys so much for watching, for sharing, liking, and commenting. That lets the YouTube algorithm know that this channel is one of the best places for all things midlife and menopause that are evidence-based. I hope to see you guys next week for a brand new video. I'm trying to get them out every week for you. I love your patience. I love you guys so much. Thank you for following along on my journey, and see you guys next week for a brand new video.